Hey guys, here for some Thursday thoughts, a day late. Wanted to talk to you a little bit more about a article that's talking about pain, particularly in regards to the opioid epidemic and trying to find ways for folks to get pain relief, get care that isn't going to be completely a drug intervention. So what it is, what this article is, it's about, it's interviewing a guy named Dr. Robert Kearns, and he is a psychologist, and he has started this interdisciplinary pain management center for veterans. Goes back into the 80s, but he's spent 4 decades trying to find different options for veterans to help with pain. But obviously that translates into help for all of us. Basically, they're trying to study the effectiveness of a variety of non-drug approaches to pain management that have sufficient evidence to suggest that they help and actually do help. So some pretty obvious points are there is a high prevalence of pain in the civilian population, and it's even higher in the with the service members and veterans. And as an interesting note, encouraging for at least chiropractors, is this outfit is going to be funding 11 other clinical trials, which are designed to look at other therapies for pain, or a bunch of therapies for pain, but one of them is spinal adjustments. So basically the findings that he said in this study were, in this interview, were looking at both evidence and benefit, was in the group of manual approaches, we can name acupuncture, massage, and spinal manipulation as evidence-based approaches that deserve more funding and more attention. And there's a lot of support for basic exercise, movement approaches, and simple walking programs. So hey, that's something most people can pull off. Things like Tai Chi and yoga also get some mention. Cognitive behavioral therapy, biofeedback, especially for headache, and hypnosis. Now, he makes a point that needs additional research, but they're going to move towards looking into that. And neuromodulatory nerve stimulation. So those are the big ones he mentions. It's encouraging for you folks that are getting chiropractic care, because they wouldn't be touching this stuff if it didn't have the evidence behind it. Makes the points that physicians in general, meaning medical physicians as a group, are not well educated about pain management. So if you feel stuck at your primary care doc or surgeon, give this stuff some consideration. Alternative stuff, but chiropractic, little bias. Check it out. So a point that's an important point here is, reading from the article, the non-drug assessment only include approaches that have sufficient evidence to suggest their potential value. And the first approach mentioned is chiropractic. When you dig down into this, and chiropractic is considered evidence-based for pain management. Now, in future little videos here, I'm going to be talking about some testimonials of folks that have gotten help from a lot of things with chiropractic care that isn't just pain, and these are case studies. And so case studies add up to be evidence. This is nice because it falls into evidence-based, which just means it's got the larger studies behind it. But when you hear case studies, understand those are important too, because that's what all this is built on. And for those of you out there that have your own stories with benefits of chiropractic, please share, because it changes things, so we can move away from this drug approach only for pain management. That's only going to help this whole epidemic of drug interactions that are essentially creating slaves to the drug. So hopefully this is encouraging for the folks that are seeing chiropractors already. Know that you are getting effective care, and hopefully it can help convince folks who are giving it consideration and who are stuck in a kind of a rut of pain medications and not feeling like they're getting anywhere with their symptoms. So y'all take care. I'll see you next time.